You've been told you have an L4, L5 disc bulge or an L5, S1 disc bulge. Well, what are some of the standing postures or sitting postures or even sleeping postures that can make your condition worse? There's a lot of them. In this video, I'm going to give you the best postures when you sleep or sit or stand that can make your condition better, and I'll show you which ones to avoid that can absolutely make your condition worse. My name is Dr. Frank Altenrath, and I'm a chiropractor in Cresskill, New Jersey. And in my office, we've helped hundreds and hundreds of patients with things like disc bulges in their neck, disc bulges in the low back, neck pain, low back pain, tingling in the arms and hands, tingling in the legs, sciatica, even things like poor posture and sports injury. And if you're new to my channel, I invite you to hit the subscription button below and tap that notification bell, because each week we put out fresh new content on how to alleviate chronic and acute pain, whether it's neck pain, back pain, pain in the arms, pain in the legs, sciatica, and we give you tips and strategies on how to alleviate stress and how to improve your overall quality of life through corrective chiropractic methods. Okay, so the first person to study the different pressures that we have in our discs with different body positions and postures was Alf Nachemson in the 70s and 80s at Uppsala University Hospital. He was going to study the loading conditions of the human spine, specifically the intradiscal pressures, the amount of pressure that's on your discs in various positions. And this is the chart that he came up with. This research was also later followed up by Wilk in 1999, who basically confirmed the same thing. So it's pretty similar. And they were the only ones that really did this type of study. So we know that load varies with body position. And what Nachemson did is he came up with this chart and used standing as the baseline. So he compared, if standing is 100% pressure on your discs, then all these different postures are going to be compared to standing, which is your baseline. So you can see here at lying down flat, you're at about 25% of the standing pressure of a disc. Lying on your side is about 75% of the pressure that you have on your disc as when you're standing. Now, going back to this, if you're lying down with a pillow underneath your legs to elevate your legs, that would be about the best. That would be almost zero pressure. That's the best you can do in terms of taking pressure off of your disc. So to be laying down with something underneath your knees. Now we can see here as standing up and bending forward with no weight in your hand is about 150% of pressure. So you're talking about 50% more standing than standing. If you're now bending over with a weight in your hand, we see the pressure goes up to 220% of standing posture. Sitting with a recliner or sitting with a chair, a chair with a back on it, we've got about 140% of standing posture. Sitting in a stool with no back to it and bending or slouching is about 185% of your standing posture. And then if you were to sit in a chair bending over and pick something up, like a weight in one of your hands or both of your hands, you're looking at about 275 pounds of pressure compared to standing. Now we also know through his research that forward flexion and rotation will increase the load to 400% of your standing load. So this is the absolute one position that we want to avoid with any type of herniated or bulging disc, is bending over and rotating your spine. So, and I'm going to show you that in the examples later on, so stay with me. But when you're bending over and you're, let's say, twisting your back to lift something up out of the closet, or you're bending over and reaching over a gate and you're trying to lift something up as your body, your upper torso is twisted, is the absolute worst thing you can do, and that should be avoided at all costs. Now this is just another chart that I found online. It's basically pretty similar to the findings, not exactly the same, but you can see that again, laying down compared to standing, which is 100%, laying down is about 24-25% of your standing posture. And as I said earlier, in this sleeping position, if you put a pillow or something to elevate your legs, you'll be at almost zero. So that's the best way to sleep, with a herniated disc, or even in a recliner, in a reclining chair, which would reduce the pressure by about 50 to 80%. So basically you see the different postures, and bending forward again without a chair back is going to increase that posture, that slouch position, about 190%. So you want to avoid these positions. And in the next portion of the video, I'm going to show you examples in real life of these postures and what we do to improve them. So the posture that we're going to use for reference is the standing posture. In the standing posture, there's going to be 100% disc pressure on the spine. So with an L4, L5, or an L5-S1 disc bulge, the most optimum way to lie is on your back with a pillow under your knees. This would reduce the disc pressure to almost nothing and give you the most comfortable and safest way to lie. Now, if you lie without the pillow under your knees, that will increase the disc pressure to about 25% of standing. So therefore, the laying with the pillow under your knees is the best, but if you're laying without a pillow, it's about 25% of standing. Now the side lying posture increases the disc pressure to about 75% of the standing posture. So it's almost equivalent to standing. So my recommendation is if you're going to lie on your side with an L4, L5, or L5-S1 herniated disc or disc bulge, you should try to put a pillow between your knees, and that will reduce the disc pressure almost in half, making your spine more neutral and making it for more comfortable sleep. The next position to take load off your spine and the discs in your spine would be the leaning back into a chair, supported sitting with your feet on a block or some kind of support that elevates your thighs. In this position, you have an equal load compared to standing in your lumbar discs. Now, if we remove the block and we talk about unsupported sitting, so now you're sitting in a chair without your feet on top of a block, now you have increased the load to about 40% higher than standing. This is the unsupported sitting position. So you're at 40% more load on your lumbar discs than if you were standing. So again, in the standing position with an L4, L5, or an L5-S1 disc bulge, just standing straight puts about 100% increase in disc load pressure on the lumbar spine. Now, if you were to carry weight in your hand, let's say 20 to 30 pounds or so, you're increasing that load of normal standing by 100%. So it's 100% more load when you're carrying something to the side like this than normal standing. Now, when it comes to lifting objects off the floor with an L4, L5, or L5-S1 herniated disc or bulging disc, the proper way to do this would be to bring your arms down, put the weight as close to your body as you can, keeping the spine straight, bending at the thighs, and lifting straight up. Okay, but even in this position, you're increasing the weight on the discs, the pressure on the disc by 240% compared to standing normal. So even though that is the proper way to do it, you still see that it is an increase in load, so be very careful doing this. Now, the incorrect way of doing this would be to bend over using your back as a long lever, and without bending your knees, you just stand straight up. And that's a good way to re-injure yourself. And in this position, in this form of lifting the weight off the floor, you're increasing the weight up to 350% disc pressure compared to normal standing. So that's the improper way to lift the weight off the floor. Now, the absolute worst way to lift something up with an L4, L5, or L5-S1 disc bulge is flexing and rotating at the same time. So bending over, try that again. So bending over and rotating, so bending forward and then rotating at the same time and then lifting the weight up. That combination of forward flexion and rotation increases the disc load by 400% compared to normal standing. So this would be contraindicated with any L4, L5, or L5-S1 disc bulge. Try to avoid those at all costs. One thing I forgot to mention is when we talked about flexion and rotation before, increasing disc pressure to about 400% of standing, and that's something you should avoid at all costs with a bulging disc or herniated disc. But that's also why the golf swing, so many people that are weekend warrior golfers, they go out and they hurt their back. They either aggravate an existing herniated disc or bulging disc, or they just injure their back. Because in a golf swing, you are flexing forward, so you're getting flexion, and you're getting rotation, so you're getting rotation to the right, and then rotation to the left, the follow through. If you're a right-handed golfer, opposite if you're lefty. But you're getting the combination of movements of flexion and rotation, the two movements that increase the disc pressure by 400% compared to standing. So keep that in mind if you're dealing with a bulging disc or herniated disc, or you just have some back pain. You might want to give it a rest and work on some strengthening exercises, or to go get checked out to see what's going on. But that combination of flexion and rotation in the golf swing can be very damaging to someone who is has or is prone to this injury. I hope you found the video useful, and if you know anyone that could benefit from this information, please pass it on to them. And until my next video, thanks for watching, and we'll see you soon. Valley Optimal Spine is located on 80 Broadway, Suite 1A, Cresskill, New Jersey. Our telephone number is 201-569-1212.